Well, back by popular demand, I would like you to welcome Keisha Christensen to the podium again. She just did great yesterday. The information, you can tell how much knowledge you have. And I think you guys can see now why I watched a presentation. I said, hey, will you please come speak for us? And she did. So please welcome Keisha to the podium.
Thank you. Super kind. Do I still need to plug in this thing? I should have been doing that.
No, I should have given that to you. Yep, that's the right one.
All righty. I'll just lay it there. I won't move around too much. That's okay. I wore some taller shoes today because I felt like I could barely see over the podium yesterday with my flats. So now I feel like I can see better. Well, thank you guys. Your group is inspiring me. You guys are a great group of people, and you like education, and you like to come to these conferences. So it's really neat to see. So it's kind of inspiring me. And for Nebraska Medicine employees, if you want to write another thank you, I know Kyle's boss because my sister is the CFO of this place. So Stephanie Dauber, write her some thank yous. She would just get a kick out of that. Okay, so I want to talk today about vaping. And so we kind of take a turn from the smoking cigarettes, and we're now into this vaping world. And I want you to know up front, I am definitely not an expert on vaping. I mean, I've never smoked, but I've also never vaped. And so some of the things that I've been learning about vaping are just strictly me learning from reading and learning about the things that are out there, and then also just hearing from my patients. So I'm learning a lot from my patients because we do get vapors that come in and want to quit. And again, it's a nicotine addiction usually, but there's just some different caveats to it. So we're going to spend a lot of time just learning about this vaping culture that's out there, kind of affecting our young people mostly. So, I mean, I'm sure many of you guys probably know some people that vape. And if you don't know that they vape, they might be vaping in secret. So we're going to spend some time learning what it's all about, what the devices are, and then we're going to talk about what the differences are between vaping and smoking, and how we can encourage and help our people quit. Some of the vaping health concerns as well. So no financial disclosures. I didn't have any yesterday either. So today we're going to spend some time talking about what an e-cigarette is, mechanism of action, how they work, how they're different from cigarettes, the risks associated with e-cigarettes, and then the research that's out there that we know about right now, and then how I try to help people quit vaping. So this professor, Han Lick, is a Chinese pharmacist. He's the one that invented the e-cigarette. So I'm sure at the time, and I've actually told a lot of people this, he most likely thought he was doing a great thing in helping people quit smoking. And I do not discount that one bit. I mean, the guy was brilliant, or is brilliant, and developed the e-cigarette in an attempt to help people quit smoking. What he probably did not realize was this boom, I guess you'd say, in the development of multiple other e-cigarette type devices and the vaping, and how it just kind of blew up in our youth. So what are electronic cigarettes? Because this was the first thing that was developed. There's many different names out there, you guys, and I've had to study these and learn them. And my patients, like I said, they teach me. So electronic nicotine delivery systems, that's why they're kind of abbreviated the ENDS cigarettes. Vapes, vaporizers, Juuls are probably the most popular one. I mean, you'll see like big signs at Casey's for Juuls for this price, and whenever I see one, I just want to go rip it down. Mods, pods, APVs, e-hookahs, and so we're going to kind of look at all of those things individually. So what they are, in a nutshell, electronic cigarettes, devices that are battery operated. designed to deliver nicotine or other flavorings, usually with other flavorings, in an aerosol or vapor form. So they're not getting the smoke and they're not getting tobacco, but they're still getting nicotine and they're getting this aerosolized vape. So basically, there's many forms, and this is basically a diagram of how they work. So if I were to point to, first off, the part of the e-cigarette that's closest to the mouth. So that cartridge that's in the purple or pink contains the liquid that holds the nicotine or the flavorings. The atomizer in the middle there is what heats when they inhale. So that's the heating device. And then there's always a battery of some sort. So that's in the green is the battery. And then most of them have that LED light. So when the person actually has their cartridge in and they have their battery charged or a new battery in place, they take a inhalation that stimulates that atomizer to heat up, and then that's how they inhale the aerosolized flavorings or the liquid that's been aerosolized. So basically, this is how all of these things work. They're just in little different devices that we'll kind of take a look at here. So the first ones, obviously over there on the right-hand side, we have our cigarette, okay? But then over here, the tanks and the mods were kind of the first ones that came out. Those typically all, and we'll look at them in a little different way, but they have a mouthpiece, they have a cartridge where that yellow is, where the liquid goes, and then they have some sort of a battery that has to be installed. The rechargeable e-cigarettes are kind of that newer model where they can actually be charged. They can have a charger port, and they typically are very small. So they're much smaller, they're easier to conceal. That's where kids kind of can buy them, and they just kind of fit nicely in their pocket. I mean, that little black one there in the middle looks like a flash drive, you know? So when they were first kind of out there, kids were very, very easy to kind of hide these things. And that little black on the end, that's that pod style. So we'll be talking about that. So mods versus pods. You have in the first little section here, some of you maybe have seen these, but you can see that they're bigger, the mods. They have actual batteries that are inserted versus the pods that look much smaller. So we'll talk about the mods first. Stands for Advanced Personal Vaporizer. Modified e-cigarettes is why they're called mods. So they're usually larger. Like I said, they have replaceable batteries, and then there can be variable voltage or wattage. So they have a tank that's refillable. So once they buy it, then they can buy the liquid that goes inside. So it's a refillable tank. It's not a disposable thing. It has the coils. So the mods became very popular with people that like to blow the smoke or just do some really cool, I guess, designs with the vape smoke that they blow out. And I have a couple pictures of those. And so sometimes when people are kind of getting addicted to these things, they sort of turn into tricksters or people that say, okay, if I get this much wattage or this much ohm, which is what I guess part of the wattage is characterized as, I can blow this much vape smoke, or I can blow this much, or whatever. So it became very popular. You can't handle sub-ohms, and that picture here on the bottom is somebody who's like obviously very excited about how much vape smoke he can blow, and it becomes quite popular. So anyway, I don't get it. Let me tell you, I don't get it. I don't understand it, but this is how people get addicted, and it's very sad. So the sub-ohm vaping, it's all about the coil. So there's different types of wires inside. There's voltages that are different, and all of this slide really is telling you is when they go into the store, they're looking at how much voltage can I get to produce this much smoke. So there are differences in how many ohms their device is. So yeah, it's kind of a science. It's electricity. Here's a power chart. So it tells you on the vaping power chart, and again, these are in the first bigger one, those mods, how much wattage they need or voltage to give them how much smoke. So in the top corner there, that dark red, it says too hot, burnout is certain. So what they go for is all of these wattage, I guess, volts and resistance in that green, because the green section is characterized as just right. The blue is too cool, they're not going to get much vapor or clouds. The orange is also hot, too hot, risk of coil burnout. So anyway, it's like a science, I guess. And I suppose all of the stores that sell e-cigarettes and mods and things, they know all this stuff. So when somebody comes in to buy something and they say that they want more smoke or they want the ability to blow more vape, this is where the people are going to guide them on what to buy. So again, just informational for us. I'm not recommending this for you guys, but I think it's good for us to know, this is what is out there. This is what our youth is kind of learning about and finding out about and thinking it's cool. So the more we know, the more we can help people. So pods by far are the more popular, easy to purchase. The Juuls are, I think, the most popular pod out there on the market. They're very easy to buy. They're at Casey's, and they're disposable. So they can buy them, and they can dispose of them and buy another one. Pods are a closed system. The e-juice is stored in the disposable pods. So that people that want it simple, they want it easy. A lot of our former smokers will go to this because they're not necessarily the tricksters and things like that, but they're still getting their nicotine in a different way. They think it's healthier, all that kind of thing. It's very inconspicuous. The youth can hide it in their pockets, their backpacks. They look like I said, little flash drives. So, and people I have found, like young adults have come in and they're interested in vaping cessation. They can keep them in their desk drawer. They can take it to the bathroom and vape quick and then go back. So it's so much easier than even cigarettes right now to become so addicted. So I'm kind of jumping ahead, but people that vape, I tend to see that they are even more addicted to nicotine. Their nicotine dependence is so high. And these are some of the people that are waking up in the night, they're vaping in their sleep. And I've had people tell me that they're like, yeah, I know I'm vaping in my sleep and I don't even realize it. So that's why it's just such a important thing for us to know about and to help our youth with this and to get them help to try to quit if they can. Not if they can, when they want to, I guess I should say. So components of the e-cigarette liquid, this is where some of the health risks come into play, okay? So like I said, that first Chinese pharmacist thought he was doing a good thing. We're not using tobacco. We're not inhaling smoke into our lungs with the carcinogens from tobacco. However, there is still nicotine, so we still have the addictive component of most of the e-cigarette liquid. So you can get zero nicotine. Don't get me wrong, you can. And sometimes when people come in and they are using the ENDS products or whatever, I actually encourage them to start looking for and purchasing less nicotine so they can start reducing as we're working on a cessation plan. But a lot of times, like those quick ones, the Juuls and things like that, they're not even necessarily really paying attention. They're just getting what they get. They're not really saying, oh, how much nicotine is in that. So they're really not aware how much nicotine they're consuming when they're first purchasing these and using them. But there are liquids that do have less nicotine content. So that's kind of where I start them off on, let's just start getting less nicotine in your, whatever you're using so that we can work on quitting. So the other dangerous things that are in there, this propylene glycol. So I have heard vapors say they get also addicted to the feel of that vape when they're inhaling, and this is where it comes from. They produces a better throat hit, so they're getting a feeling when they inhale the vape, less gunky, less residue, but this is a chemical, right? Propylene glycol that they're inhaling into their system. There's another type of e-cigarette liquid that has vegetable glycerin. So this one produces a bigger vape cloud. So, sometimes they're looking for specific things. And so the people selling them the products will kind of lead them in the directions of what's going to be a better throat hit, bigger cloud, and then they get their device and off they go, and they come back for more a week later when it's gone or less. Flavorings are in these things, and so that's another place where kids get addicted. Cherry flavors, mint flavors, chocolate flavors. There's all kinds of flavorings that are kind of similar to what would be out there in the food industry. There's also two types of nicotine. And again, I think people, when they buy the vape or e-cigarettes, they don't know this stuff. They're just buying something that their friend bought or whatever. So there's a free-base nicotine that actually has ammonia inside. And it also causes this stronger throat hit. It increases bioavailability to the lungs. So this free-base nicotine is going to hit the brain quicker. So again, when people are inhaling a vape that has nicotine, they're still getting that same dopamine release, feel-good feeling. They're still developing thousands of receptors of nicotine in their brains, and that's what causes them to get addicted. And then there's nicotine salts, which is a different type than. It has the addition of benzoic acid. So here we have all of these various chemicals that are in the vape liquid that produces a smooth throat hit, so feels good, right? Used in the pod systems, it has a shorter effect, so it's going to wear off quicker. So these are the people that are kind of hitting their vapes fairly frequently throughout the day. It does have a higher concentration of nicotine delivered in the devices with that lower power output. So again, these people really, the concern is they don't know really what they're getting. They're going in, they're saying, hey, I want this, or hey, I need more of this, or I like this feel, and then they're getting directed to buy whatever. So the dosing. So people often say, well, how do I know how much nicotine somebody is getting when they're vaping? You really don't. There are strengths of the nicotine dosing. So this free-base nicotine that could be in these little mods or pods are anywhere from 6, 12, 18, 36, 45 milligrams per milliliter. One Juul pod has 0.7 milliliters, so that's approximately 45 milligrams of caffeine. And if somebody was using cigarettes, that would potentially be the equivalent of about 11 cigarettes per day. So no, just the difference is also how they inhale. So that may be what's in the milliliter percentage of the liquid. However, if somebody inhales deeper or longer or those types of things, they may actually getting a higher concentration of nicotine every time they inhale. So that's why it's really hard to differentiate and tell people how much nicotine they're getting. So when people come in to talk about they want to quit vaping, I usually just start by finding out what percentage of nicotine device they're purchasing, and then how often they're purchasing it per week, and how many times they hit it per day. So that's kind of where I start. Most of the time we have to give them quite high nicotine replacement to be equivalent to the vaping. And then if they are continuing to vape while we're using nicotine replacement, again, I just encourage them to look and work on purchasing a product that has lower amounts of nicotine each time. So it's kind of how we go about it, but it's not very scientific. We just have to kind of start somewhere to help these people and then figure out what's working for them from there. You know you're a vapor when you read OMG as 0 nicotine. So most of the time, it's 0 milligram nicotine. So most of the time, they're not probably going to go for this. So hopefully if we get them to quit smoking or quit vaping, they will. So the various components and flavorings. So obviously, unlike cigarettes, they can go in, they can get their nicotine, but they can get a variety of flavored liquids. You guys are probably aware of this. There's all kinds of flavors out there. So it's just like some. Hopefully I'm not going to get anybody excited about going and buying a vape. I'm like, Like basically he's like telling you about how easy it is for people to go and buy them and not know what they're getting and not know what they're doing to their body. Okay, components of e-cigarette liquid, other compounds in these things, metals such as tin, lead, nickel, chromium have been found in e-cigarette liquids and vapor. So obviously inhaling these things into your lungs, probably not a good idea, okay? Risks of vaping versus tobacco. So we do know that the e-cigarettes, like I said, it spares the user to many of the ingredients in traditional cigarettes like the tars, the carcinogens from tobacco, carbon monoxide, like I mentioned yesterday, smokers will have that higher carbon monoxide level. So e-cigarettes, they're going to spare them of this. Inhaling e-vapor is likely to be less harmful than inhaling cigarette smoke, but we really don't know yet, okay? We have had many health issues on patients in the hospital, and I'll give you some examples here coming up of some damage to the insides of the lungs that has been directly caused by vaping. But, you know, again, just like cigarettes were popular when we were, you know, in the 60s, 70s, and 80s, and even 90s, and then people started to learn more about them. So we really do think that we're just at the beginning of really knowing all of the long-term effects of the vaping into the insides of our lungs.
I have a question.
Yeah.
So have you found in your practice that there are some people that were diagnosed with lung cancer that were strictly vapors?
I haven't. No, I haven't found that as of yet. But like I said, you know, it's just so young and new. I have treated people that have had like, it's coming up here, but actually like bleeding in their lungs. So the alveolar sacs have had some hemorrhage, and that has caused some very young people to have to be in the hospital on ventilators for a series of, near-death experiences. And some other kind of lung conditions from inflammatory things. But yeah, I haven't seen cancer yet. You know, the thing about cancer cells and lungs is that, and really cancer anywhere is particularly in the lungs, you know, anytime you have some tissue in the lung that is abnormal, like for instance, when we have emphysema in lungs. So emphysema is typically a result of smoking, but it can be from other things, environmental, sometimes it's a familial disease. So anytime there's like impairment in lung tissue from anything, that lung tissue is more susceptible to cancer cells growing. So we know that people that have emphysema in their lungs, they're higher risk for lung cancer, whether they smoke or not. Okay, so anytime you're damaging that healthy lung tissue, you are potentially inviting cancer cells to grow more easily. So that's just something that we know whether or not people smoke or not, or vape or not. So what's all in the vapor? There's some things in yellow here that were put out by the FDA way back in 2012. So this isn't new stuff, but many chemicals here. In that first row, the one I really don't like is formaldehyde. You know, sometimes when the liquid actually gets heated, the chemical can change, and so what they're inhaling can be different than what they think is even in the liquid. So formaldehyde is one of those things. So, and you know what formaldehyde is used for. So, you know, many things that we are inhaling or the vapors are inhaling into their lungs that could be damaging. This I just wanted to bring up. It's called a heat stick. So this is something I don't think I've ever seen anybody have this, but maybe you guys have encountered this. It's a heat not burn product. It's different from an e-cigarette. They use actual tobacco, but they don't have any flavored liquid, and it's basically called a zero tobacco heat stick. So honestly, I'm just putting this here so you're aware of it and aware of the name of it. I don't really know a whole lot about it, to be quite honest with you, but just kind of throwing it out there. So I've not seen anybody come into our clinic saying that they're using a heat stick. So I'm not even sure where to buy these things. So this is where we get into some of the health risks, okay? So risks of vaping, one of the things is pulmonary fibrosis. So it's another fancy term for scarring in the lungs. Okay, so we're potentially breaking down healthy lung tissue because of inhaling the aerosolized vape products that have some various chemicals and things that we may not even be aware that we're inhaling, but that can cause breakdown of our healthy lung tissue, can cause cell death, it can cause scarring in the lungs. So you might have heard, because it kind of became a little popular right before COVID in the news, where people were talking about patients admitted to the ICUs and they were diagnosed with popcorn lung. So that's kind of where this comes from. So there's little pockets of scarring in the lung that they have attributed to vaping. And typically it's because of some of these chemicals that they're inhaling is what they're attributing it to. And now those of you who maybe haven't treated somebody with scarring in their lungs, it is permanent. So if you scar your lungs, that's a permanent change. That never goes away. So lungs can't grow new tissue. Lungs can't become healthy again once they're unhealthy. All we can really do is help people with medications as best we can to treat those conditions. But when you have scarring in your lungs, it's permanent. It's there forever. Here's another type of lung-associated injury that was directly attributed to vaping. It was called EVALI. So again, 2019, there was a lot of vape-induced critical conditions in the news. I think COVID kind of stopped some of that. I don't know if it was still occurring and we just didn't hear about it or what, but I know that there were a lot of just news explosions of a lot of vaping-induced lung injuries. Do you guys remember this? Yeah, but it's kind of like you don't hear about it anymore in the news, but I can tell you we still see it in the hospital setting, okay? Not like an everyday occurrence, but it does still occur. So in 2019, early 2020, they were reporting more than 2,800 hospitalized cases of EVALI. 80% of them were under 35 years of age. So again, the youth and young adults are the ones that are kind of vaping instead of smoking cigarettes. Characterized by acute lung injury. Again, this fibrinous pneumonitis, which is scarring, diffuse alveolar damage, which is the alveoli in our lungs is what sends oxygen out into our bloodstream, and those were getting filled with blood. So people were having a lot of respiratory distress, obviously, and requiring ventilation. Bronchiolitis is other little almost like those little popcorn pockets of scarring and inflammation that was seen. And anyway, they attributed this to oils and chemicals found in actual bronch specimens. So when the doctors actually did a bronchoscopy to go down into the lungs, figure out what was going on, and they sampled the specimens, they found some of these chemicals. So that's why EVALI came to be. It was a direct effect from vaping. So here's another kind of picture of a condition directly associated with vaping. It's called lipoid pneumonia. So basically it's like lipid deposition in the lung, and it's from that vegetable glycerin, vitamin E acetate that's in some of the vape liquid, okay? So this cloudy appearance on the x-ray, and then over there on the CT scan, we have some dense consolidation that's in the white, and then the gray is kind of some inflammatory effect. So that's a cross-sectional view of the lungs is on the CAT scan there, and the black is good. So we're supposed to have nice oxygenated lungs, and whenever there's black, it's good. Some of the white through there are some blood vessels. We don't want that dense consolidation that's over there in that left upper lung. All right, other lung injuries associated with vaping. Do you guys feel kind of depressed now? Sorry. So basically, a lot of these things that I've already mentioned. So most of these things are really from an inflammatory lung insult, okay? Besides the bleeding and pneumonitis or the lipoid deposition. So other types of things that can cause an inflammatory response in the lungs would be things like, you've probably heard of people having like a farmer's lung. Well, farmers sometimes are inhaling chemicals, right? They're inhaling things that they're putting out in the fields, that can cause similar effects. So yeah, we're in the vape solution, we're just inhaling that directly into our lungs and onto the tissue and breaking it down and causing some of these things that sometimes are permanent. So this hypersensitivity pneumonitis, some of these things, that can actually lead people to lung transplant. So if you have fibrosed lungs, and there have been some vapors that have had lung transplant because of this. So just, it's something to be aware of. It's obviously not like happening to a lot of people, but I think if you're the one, or if you know one person that it could happen to, wouldn't you want to stop it? So again, we're kind of in the prevention world when we're trying to help people quit vaping. I kind of mentioned formaldehyde before. This is a real thing. Formaldehyde is what's used to preserve dead bodies, right? So, or preserve things in the lab. So, yeah, they could be inhaling some of these things. Acetaldehyde, I can't even say that one. So again, they're getting some of this from heating that vape solution, and sometimes it depends on how hot or how much heat is actually producing these chemicals. So heating it at the various temperatures can change it into something else that they're actually inhaling. Also, there can be device failure. So I don't know if you guys have heard of these things or seen it on the news where they blow up. Yes, that is a real thing too. I have some pictures for you. So somebody's leg that had their device in their pocket and it blew up. And obviously somebody's face, because he was vaping, lost his eye, and a lot of hand injuries. So the batteries, they can get too hot and then they can actually explode. Okay, so then we come down to straight up nicotine exposure. Okay, so we have a lot of chemicals in the vapes. Inhaling any chemical into your lung that shouldn't be there isn't a good thing, right? We can say that, smoke, vape, aerosolized steam, whatever it is. Farming, ammonia, stuff like that. So anything that enters the lungs that shouldn't be there can be damaging to lung tissue, okay? That's one thing. The vapors have nicotine exposure to varying degrees, and they get addicted to nicotine. And those of you that weren't here yesterday, it happens very quickly. So again, a lot of these are young people. Our young adult and teenage brains, aren't even fully developed until we're about 25. And so we can get addicted very quickly. And we develop multiple thousands of nicotine receptors in the brain that when they're empty, they're craving more. So I kind of mentioned before, the amount of nicotine delivered and the level of nicotine in the blood varies depending on the nicotine concentration, how experienced they are at inhaling, their puffing intensity, and then the device characteristics and their vaping technique. So they try to work on this. They try to get better at it, stuff like that. It's kind of a fun thing, I guess, that they're doing. So what that is also doing is creating potentially a very high nicotine dependence in them by practicing and doing all these various things. So risks of vaping is nicotine addiction, obviously. Nicotine drives repetitive long-term use. The amount of nicotine delivered and the level of nicotine in the blood varies depending on concentration. I kind of already said this. And it does produce measurable levels in the blood and the urine. So nicotine poisoning is actually kind of on an upswing, and we think that that is from the vaping devices that are out there, and particularly in young people and even kids, like young kids. So obviously if somebody, if you know somebody that is vaping and they have young kids, just, kind of telling them, keep it away from your kids, keep it locked up. And if somebody has potentially had a possibility of nicotine poisoning, there is a poison center hotline. Symptoms directly related to the dose of nicotine they receive, but nausea, vomiting, dizziness, tremors, sweating, high blood pressure, and severe can lead to seizures and even death. So, and obviously, particularly in the young people, this is a concern. Especially because when some young kids may start vaping and, they've never had nicotine exposure. So then now suddenly they're getting these high levels of nicotine. So that's kind of where that poisoning concern would come in. Once they become addicted, their body develops a little bit more tolerance because they're developing all these nicotine receptors. So it's kind of those early times when they're starting to vape and they think, oh, it's fun and et cetera, they're at highest risk for nicotine poisoning. So this graph might be a little bit hard to see, but number of tobacco-related calls to the Nebraska Regional Poison Center, and it starts off at 2011 and it goes up to 2018. But the cigarettes, kind of stayed steady over time, and then smokeless tobacco, which would be chew, kind of stayed fairly steady. But if you go down to the electronic cigarette or nicotine liquid, look how low it was in 2011 and how it's really escalated. So, just keeping it out of reach of young people, kids, is important. So adolescent use, I've kind of talked a little bit about this already. They can become addicted very, very quickly. And I think most of our youth want to do good, and they're a lot of times followers. They want to follow their friends. So I think if you are, just aware of the things that it can do to them, the more the more you're able to help our youth. So again, they can get addicted very quickly. It can contribute to mood disorders, lowers their impulse control, affects their attention and learning at school. These are the kids that are going to the bathroom and vaping between classes and things like that. And oftentimes people suggest that when they start vaping at a young age, it's kind of a gateway to more things. So they're going to dabble in alcohol, they're going to dabble in other substances. So it's just something to be aware of and to help our youth that's growing up in our society. So current tobacco product use among middle school students, and this was a fresh graph I got from 2011 to 2022. So I know the words are really small, but in the red dot line is the e-cigarettes. So you can kind of see how that kind of took a jump in 2019 and then again up in 2022. I don't know why it went down really in 20 or 21. Maybe that was the COVID time. I'm not exactly sure.
They weren't in school.
Oh yeah, we weren't in school. They probably couldn't like get stats on this. We probably had a drop in our data because of no stats. But I was trying to see, so the gray line is cigarettes, okay? So the gray line is cigarettes, and that averages about 4.9%. So you can see, basically, I wanted you to see this slide to see how the e-cigarettes are really jumping. The black line on top is any tobacco product, so the e-cigarettes are really climbing. And this is middle school. This is high school. So it's the same curve, it's just higher, okay? And, as the gray line went down, cigarette use went down, the vaping has gone up. So vaping is I just feel like we don't even know all the damage that this is going to do to them over the years. So e-cigarettes, the percentage on vaping for high school, 28.9% is where it is in 2022. Probably higher by now. So what devices do they start using? So when they start using, and that's that baseline there, the blue is a vape pen, the green is a mod, and the yellow is a Juul. And as they get more experienced in their e-cigarette choices and things, you see how they move to the easy one. They move to the Juuls. And that's where at 12 months, people that start vaping, they're going to that easy one at 48%. So yeah, that's another thing that I wish they weren't allowed to sell them, but that's another battle. So talk to your kids, talk to them about vaping, tell them that it's not good, be open-ended, try not to shut them down, just try to send the message that it's serious and it can have serious health consequences. And if you're the parent, be the message. If you don't want your kids to vape, don't vape either. That kind of goes with the territory, right? And I would just really tell them that they're developing an addiction. They're turning their brain into something that craves a substance, and it's an addiction that they don't want to have to battle their whole life. Nicotine risk continuum. So, we kind of go over to least harm is complete abstinence. That nicotine replacement therapy that we're recommending when people are trying to quit is there toward the least harm. We know that cigarettes are causing things like lung cancer, heart disease, lung disease, things like that. We just don't know that yet about e-cigarettes and vapes. I think this will change. This continuum is going to change when we have more data. So when people come in for vaping cessation counseling, where do I start? So this is, I kind of learn from them, what are they buying? How often are they buying it? And then how often are they hitting it? What is the percentage of nicotine? What are their habits? What are their triggers? Can they go long hours without vaping? Is it strictly habit or is it an addiction? How dependent are they on it? Are they vaping in their sleep? And then from there, we kind of develop our plan. And we do develop our plan similar to somebody who's quitting smoking, but I typically go with a pretty high nicotine replacement because usually if they're vaping, a lot of times they'll tell me that they're vaping, every hour, sometimes multiple times an hour. For sure, every couple of hours, they're going to the bathroom, they have it in their desk drawer, whatever. They're vaping frequently. And so I start high and then work down. And I do bring in Chantix often, but a lot of times I have found with vapors, they really just crave like a taste of something and that hit of something. So I actually had a patient recently tell me that she bought online this whistle that like she blows. I don't know if you've heard about that. And then also another something that she can just get a little taste of in her mouth, and it kind of has the shape of a vape, but she's not inhaling any vapor. And it just kind of helps take that edge off so that she can kind of distract herself then and move from there. So hopefully there's going to be more things coming out to help people. She wore the whistle around her neck. So whenever she kind of got the urge to vape, she would kind of puff or blow on the whistle and, obviously use like the nicotine lozenges and things like that. So we talked briefly yesterday, there used to be this Nicotrol inhaler. That was really good for people that vaped because it just would provide this little puff of nicotine into their mouth that they weren't really inhaling into their lungs, and it kind of gave them that sense of they're doing sort of the same thing, but it's not made anymore. So, we're kind of just stuck with the patch, the lozenges, the gum, and then sometimes I bring in Chantix. So I usually just kind of start to see, and then like I said earlier, I oftentimes encourage them to look at the label of what they're buying and then work on reducing and just buying less nicotine as we work on their reduction plan. We've kind of gone over this a lot. Oh, I do tell smokers, do not start vaping in an attempt to stop smoking. That was one of the things that came out when e-cigarettes were first out there is, hey, we're going to help you quit smoking, this dangerous thing. And I've had patients tell me, yeah, my niece gave me a vape and now I'm doing that. And it's like, no. So I do tell all the smokers, just don't start vaping as a help to stop smoking because now you have a new problem, and you're still spending money, you still have this nicotine addiction, it's still a substance, and so I really encourage them not to do that. I just kind of tell people, I encourage them that the ultimate long-term health consequences of vape exposures are unknown. Hopefully we're going to know more, we're going to have more percentages of health risks and potentially like other health concerns, 10 years from now, 20 years from now, similar to how we did with smoking. But it's still a substance they're addicted to, so that's where we start and we work on trying to, cure them of that addiction. Oh, this is where, I'm sorry, I almost forgot this was here. This was what came out when they were just marketing the e-cigarette. So, I don't know. USC's statewide ban on vaping flavors. Oh, that would be great, wouldn't it? Oh, yeah. Sorry, just some news press. So that Kansas report, that was in 2019. Sorry, I wasn't sure how these were all going to come up on the slide. Trump administration announces flavor ban. That was in 2019. Yeah, there was a lot of press on vaping in 2019, and it was before COVID kind of took over. Any questions, guys? Go ahead.
So there's an online question here. It says, is there any information and or data regarding disposable vapes rather than mods and or pod systems?
Well, I think the pods are disposable. I'm not sure what they're talking about there.
Pods you can charge.
Pods you can charge, but you can also, I mean,
We'll ask to clarify.
yeah, I honestly, like I've said, I have to learn about this as I go because I'm definitely not an expert. If they're delivering nicotine and they have liquid in there that becomes aerosolized and heated, it's still a danger. So I'm not exactly sure about that one.
I'll ask.
Okay.
I have a question.
Yeah.
Is there any data out in regards to secondhand smoke with these?
Not that I've seen, but I'm sure it's going to come.
Right, but nothing that you notice, I mean, like you said, I mean, with the data collection, we do need the time to figure that out.
Yeah, yeah. And I know that, that was another thing that was reported as being good about the vapes. They're, they don't smell, people can hide it because it's not on their clothing. But I have talked to people who work with people that they know vape in the bathrooms and they can tell because they can see it, smell it.
And there's some, if they are in a specific space, sometimes there's even a film.
A film. So it's definitely chemicals, So yeah, I haven't seen it. And in fact, you guys, when I was trained with the Mayo last year, they didn't have a lot yet on vaping and the stats and things like that. So I think it's just going to be a work in progress. Ongoing. And I imagine the disposables are just as bad. I just can't, if they have a heating element, unless they're those heat sticks that we talked about, if they have a heating element and they're heating up chemical and you're inhaling it, it's not like it's any better, and if it's nicotine, you're still running the risk of becoming nicotine addicted, so. Sorry.
Do you have any other questions?
It's always enlightening to me to learn this stuff because I'm just like, wow, mind blowing.
I think we got one.
Oh, go ahead.
At this point, do you know if there's any different medicines for lung stuff that has gotten through actual cigarettes versus e-vaping? Or are they kind of the same?
You mean after the fact?
Yeah.
Like if somebody has some lung damage? Nope, we have all the same medicines and there's really not much. Like if somebody has the acute inflammatory condition associated with vaping, the medicine of choice is probably steroids. So probably like high dose prednisone over a period of several weeks to try to reduce that inflammation. If they have the bleeding, they're in the hospital, and they're getting bronchoscopy to wash out and things like that, and usually also steroids. If there's an infection element, they're going to be treated with antibiotic, but it's normally just that inflammatory condition that they have. And then if their pulmonary function test shows that they have some sort of like COPD or obstruction from that breakdown of lung tissue, then they're going to get the typical COPD medications and inhalers. Albuterol, things like that.
I have a yes or no question, just.
Oh.
Would you ever refer somebody who's needing the cessation therapy to like a psychiatrist for like maybe just the routines of things?
Oh, yeah, I do a lot. I refer them if they are vaping or smoking because they're treating or trying to suppress a psychiatric feeling. Yeah. So like, especially if we get to a point where maybe they've reduced, but then they plateau and they keep vaping or smoking because they're anxious or because they're scared or because they're depressed, definitely then I say, okay, let's have this other treatment along the way. And then sometimes, usually I'll come back with them after they're treated or on a new medication. Yeah, so, no, yeah, it's definitely something that I do. Like, I don't claim to be able to treat all of their psychiatric disorders, that's for sure. One more?
It's not really a question, but when you were showing a graph of when there was a dip, I could be wrong, but I know in Iowa, there was a range where you can buy them when you were 18, and they changed it to 21.
Oh, that's probably it. Yeah, good point. Yeah.
All right, well, thank you.
All right, thank
so
you.
much.